Hello, I'm Lila Lazarus. Welcome to a very special web chat on healthcare reform. If you're tuning in now, you are probably watching or perhaps have watched a special report, Healthcare Reform 101. We thank you for joining us. We all have questions. We all need health insurance. And we're here tonight with some very special experts to speak with you, to answer your questions. They'll answer your questions live via email, phone, Twitter, and hashtag Discover Remarkable. Send a smoke signal. We want to make sure that your questions are answered. Here with us tonight, Dr. Mary Durfee, one of the stars of our show, a primary care physician, also the Executive Vice President and Chief Medical Officer of IHA. Thank you for being with us.
You're welcome.
And also next to me, one of the few in the crowd who actually know every page of the Affordable Care Act, Kevin Sears. I'm going to let you say your title because it's an extraordinary title.
I'm the Vice President of Payer and Product Innovation for CHE Trinity Health.
Which means?
It means that I oversee all of the relationships that we have with payers and any product development work that we do with payers, as well as general oversight over all things health reform related.
It also means if you have questions about healthcare reform or health insurance, he's got the answer. And we do want to hear from you. I've been going all over Detroit, finding out what the questions are that people have around Metro Detroit. And these two have been answering questions along with many others, and now it's time to hear your questions as well. A lot of information that's still unknown about healthcare reform, but what we do know is that it is coming. It is important to educate yourself, to take charge of your health, and then to start learning your options. Get engaged and get enrolled. You can call in right now. The number to call, 248-356-0077, 248-356-0077. You can also tweet, of course, at hashtag Discover Remarkable, and continue to follow us at WXYZ.com. Let me start with both of you and ask, you've seen this show that people are watching. What did you learn?
Well, from my perspective, I was genuinely surprised at the number of people who are not carrying health insurance and haven't for quite some time, and the impact that's had on their choices to receive care, to visit the doctor or not.
And that was over and over again wherever we went. I walked in a door, do you have health insurance? The answer over and over again was no. And Dr. Durfee?
I was really amazed at how much isn't known about the Affordable Care Act and how people really don't know what the exchange is going to mean and how they're going to be able to get health care and what it will cover once they get it and what their options will be.
That was a shocker for me. When I walk into your office and say, so, what are your patients telling you about this? And you look at me and you say, nothing. I find that extraordinary. People are already calling in and have questions. We got a question online. This is from Carolyn Warren, and she says, have we been missing out on any of the benefits that are already in place, or have we already been receiving benefits that we just aren't aware of?
So the good news for Carolyn and for everyone is that the benefits that will be available through the health insurance exchanges don't kick in until January 1st. So the advice I think we would have for her and for everyone is make sure that you research your options and choose a plan sometime between October the 1st and December the 15th so that your coverage can be effective January the 1st, 2014.
All right. Let's go right to our first caller. Mary from Oxford, are you on the line?
I am.
And your question for Dr. Durfee and for Kevin Sears.
Well, it's a long one.
Okay.
I'm on Cobra, which is stopping in October. I've been on Cobra for 3 years since my husband passed away. And that is the rule, which I didn't know, but I'm finding out now that my coverage ceases in October. I don't turn 65 until June. And years ago, in 95, I had breast cancer, and I was treated for breast cancer, chemo, all that. Afterwards, my test came back positive for hepatitis C. So now, this is the first time I've ever had to go out and apply for health insurance. They tell me I'm not insurable.
Well, here's a couple of good things. From now on, we're all insurable. So that's one thing she doesn't have to worry about, correct?
That's exactly right. Effective January the 1st, the pre-existing conditions that have plagued so many for so long are done away with. and we all will be eligible for insurance.
Now, what she's saying, though, is Cobra's done in October.
Yeah.
She doesn't turn 65 till June. What are some concerns for Mary?
Do you want to take
Well,
that?
I think that she has two pre-existing conditions that she's concerned about. One is the breast cancer and one is the hepatitis C. And I think, Kevin's point that that will not prevent her from getting health coverage under the health exchange effective January 1st is absolutely true. I think Mary might also be worried about the period of time between October and January 1st, and I actually don't have a good answer for that. Do you, Kevin?
Unfortunately, there's going to be a gap for Mary. So one of the things that I would suggest is if there are essential services, if there are medications, Mary, that you need, and you have the opportunity to get a 90-day supply of things like that, I would try and do as much of that as possible before the COBRA expires, and then make sure that you have chosen a plan to enroll in no later than December the 15th, so your coverage will be effective as early as it possibly can be, which is January the 1st, 2014. And then you'll be able to enjoy that coverage up until the time you qualify for Medicare in June.
Mary, does that answer your question?
Yeah, as far as choosing a plan, are you saying that would be like with any health insurance out there?
That's a very good question, Mary. On these health insurance exchanges or marketplaces, you will find a variety of plans that you can choose from. These plans are sponsored by different insurance companies, and you will be able to pick from among 4 different kinds of plans: a bronze plan, a silver plan, a gold plan, or a platinum plan. Each one of those has different levels of coverage. So for you, given that you have some pre-existing conditions, you have some medical needs now, you may want to consider a higher-end plan that may have a little higher premium but has much richer coverage, such as a gold or a platinum plan.
Will there be a website available for that?
There are numerous resources that are available. Among the websites that I would direct you to is stjoeshealth.org/ACA or healthcare.gov, and you can also call 1-855-SJ-DISCOVER or 1-855-753-4726 to get some guidance and some assistance in making those selections.
It was 1-855.
753-4726. 855-753-4726.
Okay.
All right, Mary?
Sure.
There's a lot of changes coming up for you, but it sounds like it's all going to work out for the best.
Yeah, I was wondering how to fill the gap, and obviously there isn't a way to fill it, but thank you for confirming that.
We wish you the very best, Mary.
Thank you.
Bye-bye. So she has 3 months to go before she can come up with that insurance. But it really underscores how important it is to have that insurance.
Absolutely.
Because when COBRA runs out, what would she have done with a pre-existing condition prior to this? Very few insurance companies would have picked her up.
Yeah, she likely would not have been able to enroll in any kind of coverage until she reached the age of 65.
But COBRA can let her go now before that January 1st date.
Yeah, COBRA rules are such that you can carry coverage up to a maximum of 3 years, and she's coming right up against the end of that.
All right, Mary, we wish you well. I want to go to you, Dr. Durfee, as a primary care physician. Little by little, we're hearing more and more about what this health care reform will mean for everybody. And we were talking earlier about people just don't know. They don't understand. It's a blank slate. People haven't seen it. But in this day and age, between the internet and the media, people are going to learn very quickly. What are you starting to see now, even since you and I first spoke, that your patients are starting to hear?
Well, I think that with the passage and the signing by the governor recently, we've started to see a little bit more information coming from patients and questions asking about the Affordable Care Act, what that's going to mean. You know, really, in a primary care practice, many of the people who are uninsured, when they go to get care, they go to the ER. And so we don't see as many of those uninsured patients unless they have a relationship when they became uninsured. And so really the questions that we're getting are, I'm seeing a lot more of the questions from the young people. The people that are going off of their parents' insurance, they're 26 years old, and now they need to find other options, and they're starting to ask questions.
And we know you're going to have questions too as you're watching this. Again, the number to call, 248-356-0077, 356-0077. And when you're at the cocktail parties and people come up to you knowing you're the insurance guy, what are the questions you're hearing?
How much is this going to cost me? Is it going to cost me more? Is it going to cost me less? I think that's first and foremost on everyone's mind. What are the implications of the individual mandate associated with all of this? What kind of risks do I have if I don't get insurance? How stiff are the penalties? Those are the nature of the questions that I'm fielding routinely.
Looks like we have more questions coming in. I'm going to go to line 2. Hi there. You're on the line with Kevin Sears and Mary Durkee.
Hello.
Hi, what is your question?
Okay, I'm a senior citizen. I'm 68 years old. I'm retired. My primary is Medicare. I do have a secondary supplement insurance, and my income is $33,000. I'm single.
And you want to know how you'll be affected by all this?
Yes.
We appreciate the call. Deborah, because you qualify for Medicare, the things we're discussing relative to the health insurance exchanges really do not apply to you in any way. The expectation from the federal government is that you will take advantage of the options that are available to you through Medicare in their various forms. And it sounds like you're receiving traditional Medicare coverage with a supplement. You also have available to you to consider as an option various Medicare Advantage plans that carry additional or supplemental benefits at varying levels of cost. And for you to consider those options, your open enrollment period for Medicare also starts on October the 1st and runs until the middle of December.
All right, Deborah?
Okay, so then the various plans that are being offered for non-Medicare younger people, would not, I forgot how they worded it, the exchange.
The Marketplace Exchange, yeah.
Would not then, I cannot consider as a supplement.
That's correct.
Okay.
Yeah, you'll need to look if you want to continue to get supplemental coverage for Medicare. You'll continue to access those benefits and those options as you have historically.
Okay.
All right?
Thank you.
All right, good luck to you, Deborah.
Good evening.
So many people wondering what happens if they don't have a job, if they don't have an employer. Let's go to line 3. Claudette from Detroit is on the line. Hi, Claudette.
Hi, how you doing?
Great.
I'm unemployed right now. How do I go about getting health care and you're unemployed? Would there be subsidies to help me buy health care insurance?
Claudette, the terrific news about this new marketplace for insurance is that it's completely independent of your employment status. So as someone who's unemployed, you will be eligible to purchase insurance coverage, and because of your unemployed status, you will likely be eligible for significant subsidies from the federal government to help you with the premium costs of the insurance, as well as your co-pays, co-insurance, and deductibles, depending on the plan that you pick.
Claudette, how long's it been since you had insurance?
Oh my God, it'll be a year in November.
How's it been?
And I'll be a college student in October of this year.
What's that been like for you, Claudette?
I'm sorry?
What's it been like for you without insurance?
Terrible. Because I just was in an auto accident not too long ago, and I had to pay everything out of pocket, which I don't have money for, which could have been put towards, a medication, and I got to pay for school until my financial aid comes up.
Well, good news for you, and that is you'll be able to start shopping for plans in October, and that coverage will kick in for you in January. So just make sure make sure you get online or get in touch with someone who can help you understand the plan options, and you'll be able to have coverage. And it sounds like in your situation, you'll likely be eligible, again, for some very significant financial assistance to help you with that.
All right, Claudette, thanks so much for calling in.
Okay, thank you.
What's it like for you as a primary care physician when someone comes to your office without insurance and you know they need more than they can pay for?
Yeah, it's so hard to see the fear and the frustration in the people when they come to the doctor, because first of all, they're worried about their health, and then they're worried about whether they can pay to find out anything about their, they're there because they're not feeling well usually, and they're worried about what that means. And then trying to find ways within the system to try to get what they need paid for, to get the medications that they need paid for, the testing that they need paid for, is a significant process that isn't quick.
Right. Let's move to line 2. Victor, you are on the line from St. Clair County.
Hold the line.
Hi there, you're on the line.
Hi, yeah, I actually have 2 questions, if that's possible. My first question is, let's say the premiums are going to be affordable. My first question is, I know that from what I understand, they can't deny you with the pre-existing, but from my experience in the past, these surcharges are through the roof if you have a pre-existing, or if you've filled a prescription within the last, I think, 30 or 60 days to, by their standards. I don't know if they consider it high risk, but then they jack up the rates for that. So there's a surcharge, plus your rates are going up higher even though they can't turn you down. That was my first question. Is anything going to be done about that? Because, I mean, great, you can afford the premiums, but then the surcharges is going to make it unaffordable if you have, like I said, some type of pre-existing or something.
So when
that
she
makes
says
it
surcharges,
high
does she mean copays?
I believe she means the additional add-ons to the premium. So there's a base premium historically, and if you have certain clinical conditions, you may be insurable, but the cost of your premium will escalate significantly based on your clinical conditions.
So that's the real deal, that even though pre-existing conditions can no longer be turned down, people can't be turned away, they may be paying a larger price.
Yes, but there's good news even there. So one of the regulatory changes is that the band or the range between the lowest cost plans based on your age, based on your health, and the highest cost plans has been narrowed significantly by law. So whereas you could see a range of 10 or 15 times the premium price of the lowest cost plan based on age or clinical conditions, you will never see a plan cost any more than 3 times the lowest cost plan.
So even though they may be paying a higher price for the plan, is it still the same that somebody with a pre-existing condition won't pay more than that $6,500 out-of-pocket cost?
That's correct. No matter what, the out-of-pocket cost for everyone capped at $6,500 per year.
I like that. The idea that there actually is a limit to how much you'll actually have to pay. Does that answer your question?
For the most part, I mean, so they still will be able to enforce surcharges.
They will be able to enforce some surcharges, but they will not be able to be as significant as they have been in the past.
Okay. Could I just ask one more quick thing?
Of course, go ahead.
Thank you. Again, this is based on experience. This recently happened to me. I'm disabled. I applied for Social Security. I recently was awarded, hasn't started yet. I had a hospital, I'm married, no kids. My husband has an income. He makes about $39 a year. I'm insured currently through his job. Even though we had pretty decent insurance, which I'm grateful, they covered the majority of the cost. However, the deductible was so high that I had to apply for financial assistance in the meantime because I can't even afford the minimum payment. Now, does that mean with this new program, should that happen again, if something like that happens and you can't afford to make the payment when something like that happens because of these high deductibles, what's going to happen with that? Will the deductibles be a little bit lower, or will you still be able to get assistance to pay them because I can't afford the minimum payment.
Yeah. The deductibles will vary depending on the plan type that you select. Generally, the plans that have lower monthly premiums are going to have higher deductibles, and those higher deductibles can be very significant. If you qualify for subsidies, and you'll have to take advantage of some of the online tools that will help you understand that. If you qualify for subsidies and you choose a silver plan, there will be special subsidies that will help you with your deductible, your co-payments, and your co-insurance. And I would look at those options first to see if you qualify for those before I would pursue traditional financial aid options.
I see. So there will be some type of help still available in that type of event.
Absolutely. There are subsidies through the silver plans that will help you with your co-payments, your co-insurance, and those high deductibles that you're so concerned about.
Okay.
All right.
Thank you very much.
Good luck to you. We wish you well. All righty. Bye-bye.
Bye.
Let's go to Fiona from Novi. You are on the line. You have a pre-existing condition?
I'm sorry?
Go ahead. You're on the line.
Oh, very good. I am a health insurance agent, and I deal with groups and individuals on a daily basis. And I have been studying the ACA Obamacare law for over a year and a half. I've attended numerous workshops put on by everybody from Humana to HAP, Blue Cross, etc. And in watching the show this evening, I'm wondering why more of the advisors are not recommending that employers, no matter what size they are, disband or get rid of their group health insurance plan under Obamacare rules and regulations, hurting or injuring their employee population. And the reason that it's injurious is because employees that are offered group health insurance will be unable to access their government subsidies even if financially they fall within the 133 to 400% of federal poverty level.
I'll let
So
Kevin, let's let Kevin respond to that quickly, and then we have so many questions.
Sure. Obviously, there are a host of reasons and factors that go into employers making the decisions that they do, not the least of which is there are penalties and actual tax implications based on their decisions. And those are weighing very heavily into the evaluation process that employers have.
So it's really a decision of each individual employer how they want to handle this, whether
That's
they
right.
want to send their employees to shop or to the marketplace or keep it where it is.
That's right, and a lot of their decision making, at least, is influenced by the regulations of Obamacare around their taxation and any penalties on either end. If they offer a plan that doesn't have enough coverage or plans that are too rich, they're exposed to penalties and taxes from.
We thank you for calling in. We realize it's impossible in 30 minutes to answer every question involved with this. We're doing the best we can. Let's get to more questions now. Let's go to line 2. You are on the line with Dr. Durfee and Kevin Sears.
I have a question about, I'm a senior, and I only have Medicare Part A and Part B.
Okay.
And as you know, you have to pay the 20% if anything should happen to me. Is there anything that I could do or somewhere cheap where I could get like a supplemental type thing that I could afford? Because right now I'm living on Social Security and I'm barely making it the way it is.
You have a couple of options available to you. One would be to look at supplemental plans. That tends to be, on a monthly basis, a little more expensive in terms of premium. You also could look at a Medicare Advantage plan. And there are a number of Medicare Advantage plans that are zero premium and that actually carry richer benefits, meaning that that 20% issue you're currently facing would be reduced significantly. The trade-off is oftentimes the networks associated with those plans are a little more restrictive. But those are a couple of options you could look at to help with that 20% cost.
I hope that helps.
Where do I find a Medicare Advantage plan?
Are you comfortable with the internet?
Not so much. But
Then I would recommend that you call 1-855-753-4726, and there are people there who can assist you and direct you to options to look at Medicare Advantage plans.
Alrighty?
okay.
Good luck to you.
Thank you. If there's what's the internet thing in case?
On the internet, you have two choices. You can go to healthcare.gov
Right.
or stjoeshealth.org/ACA. Alrighty?
Good luck.
Good luck to you. I want to find that Fiona. Are you on line 3, Fiona?
Yes, I am.
Yay! How can we help you?
Well, I'm 41 years old.
I say 41 years young, but go ahead.
Well, you know, it all depends on the Botox.
Right.
You should come with your birthday candles. I've been saying this for a year. On your 40th birthday, it should be a standard present is a nice vial of Botox.
And Fiona, I hate to tell you, that's not in the essential benefits that are now covered.
I know, but you know what? That's okay. That's okay because if you guys can save me some money, I can afford it myself.
All right, let's get to your
Please,
question. There's so many
just
people
a
on the
joke.
line.
That's just a joke. It's not like that at all. I'm a hairdresser. I have multiple sclerosis. And I've had multiple sclerosis since I was 26, and I was very fortunate that I got diagnosed a month after I had purchased health insurance for the first time as an adult by myself. So I was very fortunate that I got diagnosed when I did because I would be so much worse off than I am right now. But that being said, I've gotten progressively worse, and now I can only work about 14 hours a week. And my health insurance, I was only able to get through the Barber and Cosmetologist Guild of Michigan, and my health insurance is $635 a month. And I am on Social Security disability, and I only get $1,300 a month. So my health insurance is now 50% of my income.
Wow.
And that's what's covered. All the extras that I have to pay, that my health insurance doesn't pay, I have to pay out of pocket. And
Will that change now?
Yeah. Yeah, the great news for you is that given the income statistics that you just shared with us, you're going to be able to buy richer coverage at a much lower price point because of the subsidies that are available to help you with the premium. And then there are also subsidies that will help you when you do go to the doctor, receive services that will help you with your copays, coinsurance, and deductibles.
Now, I know there's those calculators online at stjoeshealth.org and different places that you can go online and see how much it's going to cost. How close is that to what the reality is going to be?
I would those calculators are pretty accurate, maybe not to the penny, but they certainly will give someone a really good idea of approximately how much subsidy they're going to qualify for.
How crucial is it for somebody like that to have the insurance they need when they get to you as the doctor?
Well, I think it's really critical, and Fiona, I really want to congratulate you on your very positive attitude despite your significant challenges. And I think that's really to be congratulated. I know it's been a tough road for you.
I was 26. I had my whole life to live. It was pointless to stick my head in the sand. I had to live my life.
And people don't realize that MS, especially in Michigan, is at higher numbers than most of the country, especially this northern line.
And medications can be quite expensive for some of these illnesses. And so the ability to be able to pay for the medications is really critical.
Right.
Yeah, because even I have decent coverage. I do want to say that I have Blue Care Network. I have decent coverage. It's an HMO, so I have to get a referral to use the bathroom. But it just adds up. It's cool that my copay is only $20 for prescriptions, which is fine if you have one prescription that you have to fill every month. But I have 6 prescriptions I have to fill up every month. So every month, that's $120 that I have to shell out on top of the $650. And the 5 doctors that I see for all my various MS-related issues at $30 a copay every 3 months. That it's overwhelming, and I'm financially, at this point, I'm financially ruined. I'm so deep in a hole, I don't even know when or if I'll ever dig myself out.
Well, the good news for you is that going forward, at least the hole's not going to get any deeper, because you're going to be much better off. You're going to have better coverage options at a notably lower price than what you're currently paying.
Fiona, we're rooting for you.
Oh, thank
Absolutely.
you. I have one quick question, though. How do I do this? So October 1st comes. I've been patiently waiting for October 1st since, the election. When October 1st hits, what do I do? Where do I go? Who do I call?
So, a couple of options for you just to get the ball rolling. You can call 1-855-753-4726 for some assistance and some additional education. You can go to stjoe.org.
stjoeshealth.org/ACA. But on October 1st, you're going to healthcare.gov, right?
To actually enroll, once you've figured out what you want to do, go to healthcare.gov.
Okay, so healthcare.gov, and I can go to St. Joe's because I conveniently work right by St. Mary's. So,
Great. Perfect.
That works out well.
Okay,
They have a
thank you
whole
so
team
much.
of people just ready to take your calls and questions and help you get through this.
Thank you so much for answering my questions.
All right, Fiona,
Lila,
thank you.
so much for doing this. This is like the best thing I stumbled on today.
Oh, Fiona, you're awesome. You have a wonderful attitude. Thanks for calling in.
Have a good
Gave
night.
me goosebumps. Thanks. Bye. Okay, you're on the line with Dr. Durfee and Kevin Sears.
Hey, everybody.
Hi.
Good evening.
Okay, so did you get my question, or you need me to repeat it?
Go ahead and repeat it.
Okay. I'm a part-time worker. My husband has full-time coverage. He has Blue Cross, but the premiums that come out of his paycheck, we each have a $1,000 deductible, plus it costs us well over $400 out of his pay every month. Plus we have the deductible, plus they only cover 80% after that. It sounds to me like the Platinum plan might actually be a better cost savings to me. Can I do that if I already have coverage available to me or not?
If you have coverage available to you through your employer or
This is through her husband's
your
employer.
husband's employer, you are required to access that coverage first. Now, if that coverage costs you more than 9.5% of your annual income, then you are able to purchase coverage on the exchange. And so,
Even if it's your husband's.
even if it's your husband's coverage.
Okay. Does that answer?
Premiums that come out of his paycheck have to be 9.5%. So not the cost of like going to the doctor or my prescriptions or that. It's just the premium coverage.
The premiums, that's correct.
Okay, so that probably would not be true. Okay, so I'm stuck with sucky coverage. And see, that's why I was like, I would love to be able to go on the plan, but because you get better, to me, is you get better value.
Yeah, for many people, the benefits that will be available on these marketplaces or these exchanges are going to be a really good value relative to what they have today.
Good luck to you. We wish you well. We're moving
Okay,
to...
thank you.
Bye-bye.
Thank you so much. Bye.
Go ahead. You're on the line with Dr. Durfee and Kevin Sears.
Hello, Doctor. I am with the Michigan Public School Employee Retirement System, and I have Medicare plus Blue Group, PPO. And what I'd like to know is, can you tell me, I don't expect you to be able to give me the number and so on, but can you tell me, am I basically going to be able to keep my own, the way I have it now, my own doctors, and is there going to be a big increase for my out-of-pocket?
I don't think at this point that there'll be any change in your ability to get the care that you're currently getting with the providers with whom you're getting it. there shouldn't be any change in your either your Medicare or it sounds like your Blue Cross PPO. And if it covers the physicians that you're seeing now, you should be able to continue to see them. As far as I know, this should not affect that coverage or your choices of providers.
Okay, because that means a lot to me to be able to keep my own doctors and so on, and just when you're on a budget and so on, it just and I'm fortunate that I have what I have, but I also have dental and vision and so on. So I'm just hoping that they have sent me a thing, and I'll make this brief. They have sent me a thing for like a seminar to go to on the 11th, so that I can find out a little more. So I'm hoping that I just wondered. I just have to be switching stations, and I told my son, you better record this because it's very interesting. So
Well, we're very glad you tuned in. We hope you get the questions and answers, the answers to the questions that you have. Again, the number to call if you need more information after this, 855-753-4726. You can always go to stjoeshealth.org/ACA. You can always go to healthcare.gov. We're glad you called in. Thanks so much. Everyone is concerned about the cost. Not only what it's going to cost them, but maybe the subsidies as well. What's going to come in. Let's go to line 3. Bob from Dearborn Heights is on the line. Hi, Bob.
Hello there.
How you doing?
Oh, I'm getting a little bit jittery because I just watched the Channel 7 program.
And what's your question?
The question basically is, according to the program, they got 4 plans: bronze, silver, gold, and platinum.
Correct.
There are people out there that can't even afford that. So what happens to those kind of people? My son is an example.
How old is your son?
He's 30 years old, and he's been unemployed now for going on a year. All he's doing is picking up part-time jobs, and they fizzle out after a couple months. He's got no health insurance. He doesn't have a car. He's living back with his parents. He's married, and but separated from the wife and daughter. Basically, he hasn't got a pot to pee in. Excuse me, but he's got no money. So
Bob, I am so glad you called because there are so many people that I met and spoke to who are in the exact same situation as your son. So, Kevin, give him the answer.
So, one, I sense the concern you have for your son, and the good news is because his income is likely very low based on what you're describing, the subsidies that are available will help him cover the vast majority, if not all, of his premium expenses, and provided that he chooses that silver plan that you were describing, he will also have subsidies to help him with any expenses that he incurs when he goes to the doctor, his co-payments, his co-insurance, and any deductibles that he might have.
Yeah, in some ways, even though the silver is above the bronze, the subsidies are better.
The subsidies are better. So if you're going to end up actually using healthcare services, for most people, the silver plan will be the better way to go.
But if you never go to the doctor, you just want to fulfill the requirement of having insurance, the bronze plan?
Then the bronze plan will do that.
Got it.
Yep.
I hope that answered your question, Bob.
really, because now, how do you get in touch with these people?
So healthcare.gov is where they'll sign up on October 1st. That's where you enroll.
Then I'm going to have to find somebody with a computer, and so will he.
And in the meantime, to get answers to your questions, you can call 855-753-4726 as you have more questions between now and October 1st, and I know you will. You can always go to stjoeshealth.org/ACA, and hopefully somebody has a computer and he can get on.
Yeah, or go to a public library. There are lots of ways to do that.
All right.
So many people in Michigan, and only 48% will be able to become available. He did not mention the other 52% that's going to be like my son.
Your son, based on what you're describing, will certainly be eligible for coverage.
All right, and what you said is, for people in the show, what you said was if it's an income of less than $11,000, most or all will be covered.
That's correct.
All right. So, Bob, I really hope that helps you out. Let's move on to Carol from East Point. Carol, you have a question?
Hello.
Hi, you have a question?
Yes, let me ask you the question again. I currently purchased my own insurance. If I continue to purchase my own insurance, but my income level is low enough, will I be able to qualify for a subsidy when the new health insurance program goes into effect?
So I want to make sure I understand your question. You're saying that today you purchase an individual policy.
Correct.
And you want to know if once the exchange products come online, whether you can purchase one of those.
No. I'll give you a simple example. I buy Blue Cross Blue Shield right now.
Yep.
Let's say next year I continue with Blue Cross Blue Shield, and I paid my own premiums. If my income is low enough, let's say $30,000 or $40,000, will I be able to qualify for a subsidy?
If your income is low enough, you will be able to qualify for a subsidy. You will need to choose, though, one of the plans that is available on the health insurance exchange.
To get that subsidy, you can't stay with where you
That's
are.
correct.
You have
That's
to go
right.
through the marketplace exchange.
Now,
Okay, so you can only do it if you choose a plan through the health insurance exchange.
that's correct. That's the way you qualify for the subsidies. Now, the good news for you is there are a lot of private insurance companies that are going to be offering insurance products on the exchange, and I think it's highly likely that Blue Cross will have products on the exchange.
Okay, next question, the last question I have. Currently, doctors can refuse to accept Medicare if they have a Medicare patient that comes along. Can doctors refuse to accept the health insurance plans purchased through this health exchange?
They can, just like Medicare or Medicaid, they can choose not to participate.
Okay.
But through the online exchange, you will be able to determine whether or not the doctor or doctors that you're interested in seeing are participating in the plans that you're looking at.
Okay. Okay, thank you very much.
Thanks so much for calling. I think you answered. You helped us answer a lot of questions there. Thank you. Let's move to line 3. You are on the line with Dr. Durfee, Kevin Sears, and Lila Lazarus. Who am I talking to?
Hello? Oh, this is Mary.
Hi, Mary. Your question?
I have Medicare. I want to know, do I need any other insurance?
No, at this point, Mary, if you have Medicare, you don't need to do anything. If you wanted a supplemental plan, you certainly could look into supplemental plans, but that's not necessary. Your Medicare coverage will not change.
Okay. And do you know if it would, if the others would cover, like hearing aids? Because Medicare does not.
I know that's a problem for a lot of our seniors, Mary, and those that do cover it often cover, you know, the least expensive type of hearing aids available. But I'm not aware of the specific coverage from the different plans and which plans would cover hearing aids or not.
Okay.
Good news is I know you're hearing us right now, so
Yeah.
that's good.
Yeah.
Thanks so much for calling in. We wish you well.
Okay, thank
All right,
you.
thanks. Bye-bye.
Bye.
Hi there. You're on the line with Dr. Durfee, Kevin Sears, and Lila Lazarus. What's your question?
Hi, this is Carol from East Point.
Hi, Carol from East Point. Yeah,
the other guy wasn't Carol from East
yeah,
Point.
somehow the lines have been all crossed today.
I'm sure. Well, that's okay. First of all, I do want to thank you for doing this. It's a great informational thing that a lot of people have been looking for answers for lots of questions. So we do all appreciate what you're doing for us, all of you three up there.
Thank you so much.
And my question is, I am married. I make way less than my husband makes. So my question would be, can I, with my income, go on a separate plan than him? Neither one of us have coverage through our employer. So let me get that out of the way first. So he is in a different income bracket than I am. So can we get separate coverage, or do we have to do it on our total married income?
Or do they have to get divorced? What's happening here?
Would not advise you getting divorced. This may be a situation where you want to visit with a financial advisor, because some of that has to do with how you file your taxes. But typically,
it's the household income.
It's the household income in total that's going to drive the subsidies.
Unless they
Okay,
pay
then
taxes
another
separately,
question
right?
That's
too
right.
would
If they
be-
file separately, then that's a different matter.
Okay, so we don't. So that wouldn't work for us. We'd have to do the household income. Also, if my son is on my, he's 23, and he has income also, would his income be in our household income? Because we don't claim him as a dependent.
If you don't claim him as a dependent, then he's not able to access coverage through you.
Right. So he could still get his own and probably qualify for subsidies because of his income.
Depending on his income.
Right. Okay. Well, that answers my question. And again, hopefully you guys will be able to maybe replay even the webcast, because I recorded the program and listened to the webcast.
Oh, I'm so
I didn't
glad.
want to miss anything.
I'm so glad, and the show will air again. I believe it's a week from Friday, so you'll get another chance to see it.
Excellent.
Carol from East
Thank
Point,
you
thanks
so
for tuning
much.
in. Thank you so much.
Take care.
Bye-bye.
Bye-bye.
Hi, you're on the air right now. Who am I talking to?
Yes, hi. This is Sue. I'm calling from West Bloomfield.
Hi, Sue from West Bloomfield.
Hi. I have a question. We currently purchase our own health insurance through Blue Cross, and we called them because we wanted to get information about what is going to happen with our premium come 2014. We have someone with a prior existing condition, and our premium will now go from $862 a month up to $970.
Wow.
And I want to know if we are able to go into the marketplace and find another
Sue,
insurance that is more...
That's a great question, because right now the insurance companies are doing a great job of marketing their own plans. I don't know about you, but I'm getting the phone calls and the mailings, and everybody's trying to keep my business. Should I stay with them? Should I go with the exchange? What's going to be better?
I certainly, in your circumstances as you describe them, would encourage you to take a look at the plan offerings on the exchanges, because you may be able to find richer coverage at a lower monthly premium price point.
Okay, and now we don't... our income is such that we won't qualify for any of the subsidies. But we can still, you don't have to be someone, you don't have to go without insurance in order for a certain period of time in order to get into that exchange?
Absolutely not. And just because you don't qualify for subsidies doesn't mean you can't purchase on the exchanges. And you may find coverage there that actually has a lower monthly premium than what you're paying. It won't be subsidized.
But if you do want insurance with a new company by January 1st, you need to enroll by
December the 15th.
December the 15th. That's a date that's so crucial here. Not only will the exchange open October 1st, you need to make sure you are enrolled by December 15th if you want to have that insurance, Sue, with a new company by January 1st, okay?
Okay. And will there be name companies that are familiar to us, like Aetna and Blue Cross and...
Yeah, we don't want insurance or us.
Yeah, most certainly. Depending on the market that you're in, you will find numerous familiar name brands on the exchange, as well as some that may be new. But you'll be able to find those traditional insurance carriers on the exchange.
All right. Good luck to you, Sue from West Bloomfield.
Yes, thanks for answering our question.
Thank you.
Bye-bye.
Bye-bye. Line 1, you are on the air with Dr. Durfee, Kevin Sears, and Lila Lazarus. Who am I talking to?
Hello, this is Bianca from Plymouth.
Hi, Bianca from Plymouth. What's your question?
Okay, no one is asking you questions about procedures here. My husband and I are very curious to know, will there be any restrictions for different procedures due to age or health conditions?
Right, and on the show, people were asking that question. There was, one woman who said, hey, I heard I can only get a pap smear every 3 years. Hey, I heard, at my age, I can't get a colonoscopy. What's the answer for that, Dr. Durkee?
Yeah, you know, Bianca, I think that it's an excellent question. And I think it really depends on the health and the risk factors of the individual, but there aren't going to be restrictions if it's an appropriate treatment. If you need to get a screening colonoscopy and you're in a risk category that needs a screening colonoscopy, you'll have a screening colonoscopy, or you'll have a pap smear, you'll have a mammogram, or any of the screening tests that you now get. And the same thing for any procedures that need to be done because of medical conditions that you either have now or develop in the future.
So are these things that people are saying, is that coming from naysayers who don't want to believe this is going to work? Where are all these rumors coming from that so much won't be covered?
You know, I don't know where those rumors are coming from. I think fear is a concern for people. Change is hard. And when there's change, I think sometimes people start saying something and pretty soon it becomes a truth. Because they're worried about change.
Does that answer your question?
Well, the reason I had asked is because last year I had to have an MRI, and I was really in bad shape, so I was immediately referred to the MRI department at St. Joe's, and they took me immediately, and I had my MRI. My husband this year, they thought that he had torn rotator cuff, and the doctor said, you know, I cannot send you immediately to the MRI facility that we have here at the hospital. You have to fill out some forms, and you have to wait, and we have to call someone, and that person will let me know if we can send you ahead and for me to write the script for you to have the MRI. So that, having a personal experience like this, that's why my husband and I have been questioning.
What's the bureaucracy of it?
Yeah, Bianca, what you're describing is a process called prior authorization that is necessary with some insurers for some procedures. Generally, it happens very quickly. To my knowledge, there won't be any increase in that under the Affordable Care Act or on the exchange. It's just that some procedures need to be pre-authorized. We've actually never had a problem getting something authorized that I, as a provider, think is indicated in my patient. It's simply a question of calling the insurer that does the pre-authorization and getting the pre-authorization number. But that's a simple process, and we're quite used to it.
All right.
I didn't have to go through that, and we had the same insurance. So
and the same primary care physician or the same physician?
Different physician, but under the same insurance.
It might have been a different diagnosis, Bianca, and so some things like MRIs might need to be pre-authorized with one condition, but not with another, and that might have been the difference.
All right.
You know, let's say, suppose you're older and in your 80s, and you might have cancer, let's say, and you know, there's talk that certain procedures are going to be denied. So, you know, that all encompasses the question I was asking.
Don't believe all the myths.
So,
that would be the recommendation.
Okay.
All right?
Thank you so
Thanks
much
so
for
much.
your time.
Thank you. Good luck. Bye-bye. Hi, you're on the line with Dr. Durkee, Kevin Sears, and Lila Lazarus. Who am I talking to?
It's Greg.
Hi, Greg. What's your question?
I'm self-employed, and I was on a COBRA plan for my previous company, and that was way too expensive.
Do you have insurance now?
No, I don't.
How long has it been?
About 4 months.
Okay.
And I'm just wondering, what can we expect for premiums to be for just average insurance for one adult?
Thank you for the question, Greg. It's going to depend on the kind of plan that you're interested in purchasing, but for those bronze and silver plans in southeast Michigan, in this general area, you're probably looking at somewhere between $200 and $250 per member per month for your premium.
Yeah, that's about a third of what I was paying on COBRA.
Yeah.
And what about pre-existing conditions? I kept COBRA for a little while because I had some back problems, and then that was declined by Blue Cross Blue Shield.
Can't happen anymore.
Yeah, you won't be able to be declined because of your pre-existing condition. It may cause your monthly premium to edge up, but depending on the condition, it may not be that significant, and it cannot, by law, be any more than 3 times the lowest cost plan in the category that you're shopping.
Great. Appreciate it.
All right, Greg, so you're going until January 1st without insurance, huh?
I'm trying to hold out, yeah.
Stay safe.
All right, thanks.
All right, good luck to you. Bye-bye. Line 1, you're on the line with Dr. Durfee and Kevin Sears. How can we help you?
Hi, what if you have Medicare? What will happen to that?
There really shouldn't be any changes to your Medicare coverage, Robin. That should continue as is. It should have the same coverage that it has now.
Okay.
Does that work for you?
Yeah.
That seems to be the number one question. People on Medicare worried that somehow this means a change. If you already have insurance with your employer, chances are very little change, correct?
That's right.
We may see changes over the next few years as this whole thing sort of evens its
As
way
employers make decisions about the direction they're going to take.
Right. All right. Thanks for calling in. You are on the line. Who am I talking to?
Hi, this is Beverly from St. Clair Shores.
Hi, Beverly from St. Clair Shores. What's your question?
My question is, I'm 63. I have 2 more years before I can get Medicare.
You're on Social Security.
I'm on Social Security. I get $1,500 a month. Will the government subsidize this amount for me? Do you have any idea?
Yes. If that's your only source of income, you will be eligible for a significant subsidy. You can either go to healthcare.gov or stjoeshealth.org /ACA, and there's a calculator function where you can plug in some basic information and get a very good sense of exactly how much in terms of monthly subsidy you qualify for.
Okay, that's great. That's great.
All right.
Okay, I thank you guys kindly.
Thank you.
Have
Good
a good
luck.
evening.
Bye, Beverly.
Bye-bye.
Hi, you're on the line with Dr. Durfee, Kevin Sears. Who am I talking to?
Hi, how are you?
Good, and you?
Good. My question is both me and my husband are 51, and I would like to get health insurance, but I was wondering if you could get it through like Social Security or if you could get it through like social services.
Typically, those are not avenues where you can access health insurance. One of the reasons that the federal government and states are setting up these health insurance exchanges is to create a way for people who are in your circumstances to get insurance. And that really is the mechanism that they're intending for you to use to get coverage.
Okay. My husband's work is offering him health insurance, dental and optical and health, you know, for hospital and stuff like that, but it would be like taking a big chunk out of his paycheck.
Yeah.
And that's the problem right there, and it's like, oh my God.
So in her situation, would they be required then to take the husband's
Yes,
employee's plan?
as they go through the qualifications for enrollment on the exchange, they'll have to answer some questions. And if the cost of the insurance through her husband's employer, or through your husband's employer, is greater than 9.5% of your annual household income, then you would be able to purchase on the exchanges. Otherwise, the expectation is that you'll get that coverage through your
What if
husband's
there
employer.
is an option at her husband's employer that's less than that 9.5%?
Then they'll be required to take that.
Got it. So that could be your answer?
Can I go through St. Joseph's Mercy Support, maybe?
Well, give them a call and see if they'll be happy to answer any questions that you have between now and actually all through this enrollment process. You know you can always call and get an answer at 855-753 4726. I'll say it again, 855-753-4726. If you have a computer, you can always go to stjoeshealth.org /ACA, and then as it comes time to enroll, you'll want to go to healthcare.gov. Alrighty?
Oh, let me see, St. Joseph, right?
stjoeshealth.org /ACA. All right?
APA?
ACA. C as in cat.
ACA.
All right, we wish you good luck. So many questions. If there was one take-home message that you had for people, Dr. Durfee, tonight, as they wonder what to do, what this is going to mean, what would that message be?
Well, I think for me, the take-home message would be learn about the exchange and get signed up, because coverage is key to your ongoing health care and building relationships with primary care physicians. It's so important to be informed and to understand the exchange and to get signed up.
And to get that primary care physician and make that relationship happen.
Yes, it really makes a difference to care, because a primary care physician really understands your value system and helps you make decisions based on your own values, rather than the kind of care that's very interrupted and fragmented.
Your
So
parting
true.
message?
Listen, I know for many people this seems complicated. Don't feel like you have to go it alone. There are lots of resources out there to help you make a decision that's right for you and your family.
Get informed, take charge of your health, use the resources that we've told you about. We're all going down this road together. Thank you so much for tuning in. To my little friends Maddie and Megan, go to bed. Thanks for tuning in. Bye-bye.